Many of us have our heaters blasting during these freezing temps, but the solace from cold could actually turn problematic if you aren't careful.
Yeah, that is so right. During the 2021 freeze, Memorial Hermann in the Medical Center saw more carbon monoxide poisonings in a single day than they did in an entire year. Dr. Carrie Bakunas is here with us, joining us via Zoom. She has some tips and some preparedness so you don't end up in the ER this time around. Good morning, doctor. We appreciate you.
Good morning. Thank you so much for having me.
Thank you. So we talked about carbon monoxide. Explain to our viewers what exactly is carbon monoxide poisoning.
So carbon monoxide, first of all, is an odorless, tasteless, colorless gas that essentially displaces oxygen off of the red blood cells. And because of that, it can cause significant tissue damage and even death. With regards to symptoms, that really is a range depending on the severity of the carbon monoxide exposure. So some patients will have a headache, lightheadedness, some dizziness, nausea, vomiting, and then in more severe cases, they may even pass out.
And we always warn everybody if they lose electricity and they have to count on a generator, that it is so important to keep it away from the home, to pointing out away from the home, and just a lot of things to be safe with that. Are there any other reasons that you see carbon monoxide poisoning during freezing weather?
Yeah, so when people get cold, they tend to try and get creative when it comes to keeping their homes warm, which is understandable. So sometimes we saw people bringing in gas stoves or charcoal grills from outside and using those in the home, which is not great because it's not a well-ventilated area. And then even using your gas range at home or your oven against manufacturers' recommendations can produce toxic levels of carbon monoxide.
I know one big thing, too, that can be really dangerous, especially in this weather. You may want to go out, just say you have a garage, an attached garage to your house. You want to warm your car up, and then you don't lift your garage door. That is very dangerous as well, right?
Exactly, yeah. So having a running car in a garage, especially if it's attached, like you said, can allow carbon monoxide to get into your home. And like I said, since it's odorless and tasteless, it's essentially undetectable unless you have a carbon monoxide detector in your house.
Now, is there anyone who would be more susceptible to this, or is everyone who is in the path of carbon monoxide at risk of poisoning?
I mean, it can be toxic to everyone, but there are some populations that are more vulnerable. So the elderly tend to be more susceptible, and people with cardiovascular disease. And then lastly, pregnant women. So fetal red blood cells actually bond stronger with carbon monoxide. So fetuses can be affected at an even lower level of carbon monoxide poisoning in pregnant women.
So bottom line here, what are some precautions you should take, tips for people if you want to stay warm, if you want to warm up your house, but obviously you still want to be safe?
Yeah, I mean, so using your traditional heater, using a well-maintained fireplace, those are all great ways to stay warm. Avoiding non-traditional ways to stay warm, bringing in grills from outside, using generators inside that shouldn't be inside, and like I mentioned before, using gas ranges, stoves, and ovens to heat your home. Those are not great options for keeping you warm.
And let's face it, especially if for Texans who have lived here their whole life, we're just not used to a wind chill like what we have, close to zero in some areas this morning. So what is your advice, just quickly, on staying outside for an extended period of time away from your home?
Right. So if you have to go outside, it's really important to keep the areas of your body that are vulnerable to frostbite covered up. So wearing gloves, hats, scarves. Of course, layers are really important. And where people get into trouble is if their clothes get wet and then they keep on those wet clothes. So if you have wet clothes, you need to remove those right away.
All right, Dr. Carrie Bakunas, we appreciate you with UT Health Houston and Memorial Hermann. Thanks a lot for your time and all of your
so much.
Valuable insight.